Welcome back to Val-You Based Care. I have Dr. Julie Chang here today with us, which I'm so excited to be with you, Julie. Really, I've been wanting to do this for so long, and I think a lot of people can relate to having that person in their life, whether it's like a school teacher or someone who was their coach after school. But for me, I really thought about my HEMONC training as it was very rigorous, of course, but I have very fond memories when I think about you. So thank you so much for joining.
Thank you for the invitation, and I have very fond memories of your time in training too, so it's been an honor to know you these years.
Yeah, I really value this. I feel like we have this like a mentor mentee, but also like a friendship, and really I've spent a lot of time reflecting about how special it really was to have that connection with you, how much you truly have this influence as a mentor. And I thought about how it's very difficult to be a mentor. And sometimes it can be easy to get in one's head and go, "Oh, I want to be a good scientific research mentor," or like I need to mentor this student through a rotation. But I felt like you were very much someone who just raised a person. You're just wanting to make sure a person came out whole on the other side, and, really wanted to explore that with you, thinking about when you were mentoring, and I'm sure you have so many people that you could even recall all these stories, the significance of mentorship for you, especially nowadays where I feel like it feels even more important that we have mentors, that we can rely on people who are there for some of that almost like invisible work, but we really need mentors. So, yeah, I'm wondering
Right.
about your thoughts.
Sure. You know, I do think that, when it comes to being a mentor, it's important to recognize you're really not for everybody, right? I mean, there's like some people who are, heavily invested in doing like lab-based work and like, really want to like spend a big majority of their life, sort of dedicated to being a scientist in their craft. And, those are people that are probably not going to look to me as their, as their mentor, as somebody who, loves clinical medicine, has an interest in basic science, but that's not really, sort of my, my main focus. And, who also is very heavily invested in, spending time with my family and supporting that part of my life too. So, I mean, I think part of being a mentor is just realize that there's some people that you just probably don't have a ton of mentorship to offer them outside of, maybe whatever direct interaction, maybe you have in the clinic. Um, but, when you do have interactions with people that you feel like there's kind of common values there, in terms of not only clinically what they want to, uh, excel in or, just kind of their values in their personal life. I think that's where you can really validate, what they want. So like, for example, in the fellowship, where, I know we met, but, certainly there's been many other fellows and even residents that have come through. When I do have interactions with trainees who, just really are very interested in providing excellent clinical care, that's something that I don't think is always valued in the academic setting. And so having the opportunity to just really, foster that, being an excellent clinician and taking that out, in not only academics, but also in the community, like that is a very, valuable skill. And people should not feel that that is any lesser than, folks who stay in academia or publish or do research. And I think too, really recognizing that trainees are people too. They're going through their own things. I mean, I have such a heart for trainees who or people earlier in their career that are, maybe in a new marriage or a new relationship or starting parenthood. That is so unbelievably challenging. And, as much as you try to read about it and know about and prepare for it, like nothing prepares you for it. And so, just being there to be the like very, compassionate attending to say, it's okay if you feel overwhelmed, that's really normal. Or, please go home early, we can handle this. We all just need that support as, as humans. And so, I feel that that was something I really tried to be very aware of in terms of what are, not only trainees, but, just people in my everyday life, what are they going through right now? And how can I just support them in a very practical way, even if it's small?
Yeah, and I definitely felt that support from you, and, and it's very almost, it may sound hyperbolic, but it almost sounds to me, brave when a mentor is showing up for more than just the title or the project, but even just being there thinking, "Oh, well, I've you've seen some of those hard times too, and you're gonna be there for me or
Yeah.
for anyone else going through that." Uh, it the reason I say it's brave is because I think it can be frightening for mentors to do that. I think just
Mhm.
being very authentically present for someone else, it can be really uncomfortable because sometimes don't know if we're gonna say something or mess something up or, like,
Yeah.
how much when we get involved, how much are we, uh, going to mix emotions in with the profession, and sometimes that can be really actually hard to manage our own emotions. So I felt that immense courage from you that it wasn't really um, something to be so afraid of being able to connect and share all of the things that I was going through because I didn't really sense you were so afraid of all these experiences. You're just going through them and recognizing them and very plainly speaking about them too. I think some some mentors can be afraid that they're not supposed to be speaking about these things or it looks kind of weak or they have their own perceptions about what it looks like. But and it
Yeah. And oh, I'm sorry, didn't mean to
oh no,
interrupt
you
you.
go ahead, please. I just
I was
think
gonna say, you're probably, pretty aware of like Brene Brown's work and, talking about vulnerability. And I don't, I probably discovered that, I don't know when it was popular, maybe 10, 15 years ago when she really started having some TED Talks and had her books. But I mean, I do think that a lot of the research around vulnerability and that it's actually, our hidden strength when we're willing to show that to other people is very powerful. And, I do think that for women in medicine, um, showing vulnerability has always, sort of felt like a weakness. And I think even just a generation ago, how uncommon it was for women to be in medicine. And, you did not want to show vulnerability. Like the way you succeeded was to act just like your male counterparts. And as there's been more women in medicine, I feel like we have a little bit more freedom, to show that vulnerability.
yeah, I almost felt like going through training there was almost like a little bit of a badge or a leverage that as you get more credibility, you could show more vulnerability. And it
Mhm.
wasn't so much as a trainee, one could really do that. But
Yeah.
having that little micro space with you, I felt like I could do that. And so I very much appreciate it. I think it's very hard nowadays, even more so thinking about the younger generation of trainees like, I'm out in the community, so I don't necessarily see as many residents and fellows, but I can
Mhm.
only imagine how in some ways things are better, like, probably there's a lot more women out there, but in other
Mhm.
ways, I just wonder how much more of the responsibilities of being a woman in medicine and being somewhat sandwiched, like having children, but also take care of parents and keeping
Yeah.
up with rapid changing landscapes. Um, Being able to show up for each other. Like,
Yeah.
I may not have trainees, but I work a lot with nurses and nurse
Mhm.
practitioners, and I'm realizing they really thrive on sharing that vulnerability. Like, they really want
Yeah.
that as part of working with a provider, which I find to be very interesting. Because before, as a trainee, I didn't think I could do that, and now it's like, "Oh, this is telling me I'm going to a place now where people are looking at me like now I have leverage, or they're hoping that I'll be kinda standing on some sort of a post that allows them to be able to rise." So, very much feeling like a translation of life, like you mentioned being a mom,
Mhm.
uh, very much recognizing community. Like, I felt always felt like you were very busy in clinic, of course, but you had a full, rich life outside. So, thinking about all of these ways of how to show up, and it's very different for every woman, but we can really support each other. Wanted to, because I'm just so curious about your family and your children and how much that probably infuses a lot of your, like, other superpowers, like, aside from vulnerability.
You know, being a parent and, a mother specifically, obviously poses a lot more challenges in balancing, career and family just because as you know and any physician knows, it's not like the work is 9 to 5 and no other time. There's call, there's things you're doing after hours, there's just a lot that's part of a career in medicine. Um and so that's obviously challenging, but I also feel like being a parent has really just made me such an immensely more compassionate and caring and understanding person. I mean, I really think before I had children, I just very much felt like there was only one way to look at the world. And, everybody should see things the way I do, and everything's like very black and white. And some of that could just be being young too, right? You kind of see the world a little bit less in shades of gray. Um, but my children, yeah, I have 7 children and they're, incredibly diverse. 3 of them are adopted, 4, were came to us by birth. But especially my adopted children are just so incredibly different in how they, see the world and feel about things. And even some of my, biological children too. Um, that, it just helped me really have an appreciation for if having an interaction with another, colleague or, a patient or, anybody, like if it just wasn't really making sense to me, why we weren't seeing things eye to eye or, having some conflict, just really being a lot more curious instead of frustrated. I mean, I remember when I was training, there was all this talk about, patient like non-compliance and like, I just never think that anymore. I'm just always like, I wonder what is going on with them. Like, what's going on in their personal life? Like, what concerns do they have that they don't feel comfortable talking with me about? What barriers are they facing and how can I, support them through that? Especially as I've like had teenagers who just sort of, they kind of just do their own thing and they see the world, wildly differently. But as their parent, you want to understand them and, support them through that tumultuous time. So, I like as hard as being a parent can be sometimes, it has been, absolutely not only the most rewarding experience, but, I think unquestionably has made me a better physician. And frankly, sometimes I'm glad I had that outlet, after you are arguing with a 3-year-old for, 4 hours on a weekend, it's nice to go back to work and talk with some adults, so
I'm surprised you have the endurance to do 4 hours. I'd
Yes.
probably check out, like, put myself in the baby pen, and I'd be in the middle and crying, and everyone else has to give me space, so
Yeah. Yeah. Yeah, and I think, like, dealing with, like, little people and adults, it just helps you understand, like, sometimes people just they kinda max out, they're just kind of they just need their space and they're just kind of overwhelmed and, just giving other people grace about that too. So I definitely feel like going through the marathon of raising children, especially toddlers, like helps you to be a lot more tolerant of things.
Yeah, that's a
Yeah.
really great way of putting it because I have seen that too, where, yeah, there's the initial, maybe some attrition of energy with raising the little kids, but then over time, clinic is not as hard because those conversations aren't so frustrated by our own getting in our own way, being like, well, why are they doing this? And it's more like, oh, well, their world must have all of these different things that I just need to understand more. And then building that communication, I feel like that's a skill that I didn't really appreciate through any of school really even training. Like, I thought I knew what good communication was because I take classes and do modules, but then now I'm appreciating it at such a different level where it really is, something I wish we could go back in time in school, even kindergarten, learn communication like its own science. But, yeah, I felt like you helped me a lot with that. Like, feeling like there's a different way to communicate in clinic in terms of talking with patients. Like, I felt like you were very good at listening, where sometimes we feel like, people are listening, but they're really just waiting for their turn to talk, and I felt like you really give a lot of space to people. There's just a lot of active, like, I always felt like you were really taking it in, soaking it in, really reflecting. And that's very different from what I felt like I grew up with or was taught, where doctors have to be they're leaders and they have to take over the conversation and they say this and the patient listens and that's how it is. But yeah, I definitely really appreciate how you have this very direct but very kind way of approaching things. Curious if like, yeah, I know you mentioned Brene Brown, but the kind of things that you do to help teach yourself, the communication skills, just being so good as you are, probably it comes naturally, but wondering what are the other resources that you reach out.
I would say it does not come naturally to me. I'm kind of an evolving, work, yeah, as time goes on. Yeah, I think that definitely things have changed for me in terms of like the mind shift. I mean, I think when I was initially in, residency, of course, like you're just so busy and you got so much going on. Like you do kind of enter patient interaction saying, like, okay, I have an agenda, and I'll listen to you as much as I can, but eventually we're just going to have to like follow my agenda. Um, and then going into fellowship, like, I think that, you're really focused so much, like, on many of your interactions, like, in the hospital and in clinics, you really get used to breaking bad news, and I think that I was definitely very much in my head a lot of the time about, like, how am I gonna break this bad news? Like, how are they gonna react? And so, like, that is very hard, it takes you years to really feel, comfortable with that, and I think that I do try to let, trainees know that, like, it's okay if it still feels really hard, and I even understand to some extent when our nurse practitioners are part of the group are really reluctant to, like, be seeing patients who could potentially have a scan with bad news, like, I feel like I understand where they're coming from in terms of their comfort level with things. I think eventually, once, I felt like I was a little bit far enough into my training, I could relax a little bit and not sort of feel like I always had to be 3 steps ahead of the conversation. And I think too, initially I would always feel very worried about the emotional response of the patient. Like, how can I say this? And, every time the patient would, give off some type of emotion, whether it's sad or angry or something like that, like try to really redirect the message. And of course, a lot of that's appropriate, right? Like we're always trying to see how our patients are feeling, but eventually getting to the point of, I'm going to say what's going on and I'm going to be kind about it. I'm going to be compassionate about it, but we're going to ride out these emotions together and it's going to be okay. And kind of getting to that point where, I could sort of surf along the tears and the anger and, the questions and the, whatever came with it. And I feel like that was a real breakthrough, for me, to just really feel like I can be really honest with patients and know that I'm giving good care and not, worry so much about the sort of emotional implications of that. And, I do think that as I felt more comfortable with that approach, it was easier to just sit back a little bit more and let patients talk and not feel like I had to always be like directly managing the conversation. And plus, I just find patients just endlessly, I don't wanna say amusing, that sounds negative, but I don't know, just, like, people are just so interesting, and the stuff they'll tell you and share with you about their lives, like, it just really got to enjoy patient interactions, not seeing it as like, "Oh gosh, this is somebody else I gotta talk with about their, their lymphoma and go through their scans." So,
Yeah. I completely feel like, whenever we sit with patients and then there's always a little bit of that, like that build up, like you're talking about, that anticipation.
yeah.
Completely agree with you. I'm still in an earlier career, I'd say. So I definitely still get that, like, oh my gosh, yeah, how's this gonna go? But you're
Yeah.
right that in a lot of ways, it letting the events unfold naturally is really the kinder thing, is just they're going to be very upset, so it's not even fair. You could even kinda call it, I don't know if manipulation is too strong a word, but to think that someone's gonna sit there and take bad news and force them to be okay or happy about it
Mhm.
is, yeah, very unrealistic and probably what builds that anticipation. So,
Yeah.
yeah, I think being able to go in and say, "This probably is gonna be very hard for that other person,"
Mhm.
and then my role is really being there for them so that they feel like they can build trust with me.
Yeah.
That was a breakthrough that has probably come for me through community work, really.
Yeah.
I feel like the academic work, there were so many endpoints to try to hit, like, "Oh, am I
Mhm.
being efficient?" Or, "Oh, am I publishing and like, seeing enough patients and balancing the publishing?" And you're right, there's a lot more, at least in the community I've noticed, there's a lot more of that not really measurable, but you really know you're taking good care of people, kind of
Mhm.
like, karmic feeling, like you're letting people have space with you, especially when and I'll have some of these too where I could totally see myself 10 years ago being really impatient and upset that a lab is behind and I can't sit down and just get the lab done and move on. And then
Mhm.
sometimes I'll just sit with my patient now and be like, "Oh, the lab's late." And then we just have this very spontaneous human conversation like, "Oh,
Mhm.
well, do you wanna look at this picture that"
Mhm.
and they'll show me all this stuff that, like you said, is amusing. I know what you mean by amusing. It's like, "Oh, like, I bet you would only tell your mom. I'm like, wait, now you're telling me, and this is really funny." So,
Yeah.
and it helps to break up that burnout feeling of on paper, yeah, it would feel like all these conversations are gonna look like burnout, but when you ride with it, it actually takes us back to why we became doctors. And I think your mentorship has been very helpful for reminding it. I keep saying that like you're my mentor now. Like,
I'm like, "Oh,
I would like to be if I could see who
you've never left me."
Yeah, one of the other things I was thinking about as you were talking, I think one of the other things that I've evolved into as, I've further into my career is, I think at the beginning I would always feel like I have to have the right answers. Like I have to know what the next step is. Like, when have we done everything we can? Like when, it just kind of always feeling like gosh, they expect me to know everything or I'm not providing good care if I don't know everything. And, just really realizing over the years, like people just really want you to walk with them. Like they want you to know that you're there with them, because I just think of, I've had patients who just have had horrible complications from their cancer or their treatment. And just going into the hospital when they're, hospitalized and there's like not a darn thing you're going to be able to do for them. Like you're not giving them chemotherapy when they're, really ill and on multiple antibiotics and just had surgery. But, um, just having that connection of them knowing that, here, I'm here for you, even if it doesn't mean I've got all the answers or I've got a great treatment up my sleeve that's going to make me the, hero in the situation. So I think I've definitely gotten a lot more comfortable about the fact that like that is my role as a physician. Like, and being honest with patients sometimes about like, I'm not really sure what the next step is. Like, we might need to think about this a little bit, or I need to talk with some of my colleagues. So, you would think that patients would react very negatively to that, like, "Oh my gosh, you don't have all the answers." But, I really think that patients value that partnership, through good and bad times, much more than they expect you to always know the right thing to do.
Yeah, I couldn't have said it better. And I was even thinking, especially nowadays where I feel like there's a widespread erosion of trust where people in general are like, "Oh, can I trust like an institution or like a group or a government?" But they still seem to really trust us, that one on one, and being able to I've done this now that we have AI, being able to say, "That question you just asked, I never studied that in the textbook. I'm gonna, like, turn over to this computer with the AI technology," and they actually really like that, and I've had people say that, like, "I thought most doctors would feel kinda nervous to admit they don't know, but I really love that you looked this up and you printed this out for me because now I feel like I learned even more." And then they just seem to trust more, and I really love what you also mentioned about just being there for them because it sounds kinda like, yeah, like a maybe a little like a platitude or a little cheesy to be, "Oh, we just have to be with our patients," but I noticed this through community work, it took me time to realize this, is, sometimes if they're in the hospital and I happen to be at the hospital, even though they don't need me because 'cause they're just getting an antibiotic for an infection, they really appreciate it. I just pop my head in and be like, "Oh, I happened to be here and I knew you were here." And I didn't really do anything, but they love that. And these are all those little things that I have had to learn the hard way. Hard way meaning, like, it wasn't really taught to us. And then pick up on people as, like, I didn't do those things, and now I go, "Well, there's a better way," and these are the better little small daily things that build up. They don't have, like, a big explosive effect in one moment, you have to really do a lot of it over time. And back to your point about mentorship, where sometimes it lands really well with some people, and then others, maybe their values are different, and they may look at it very differently. And having that feeling of, well, this is just the way I'm gonna like, this is my definition of integrity, so this is how I'm gonna do it. And I feel like I have the good intention to show up this way. And hopefully the folks who appreciate it we have the same values, and there's always gonna be those people who are looking a different way, and that's completely okay too. I think that peacefulness is very hard to come by, especially for trainees. I think in this generation particularly. But I just like put all of my stream of consciousness on you so that you can solve all these problems, all the world problems.
Yeah.
I wish. Yeah. Yeah, the older you get, the less you realize you know, so I'm not here to solve any problems, but I can share what I can. Yeah.
Yeah. Yeah, and I was also thinking about the role of work because as much as I love talking about our roles as physicians, there is that important other part of our lives. And it's not so diametrically opposed. It's not like there's work and then there's non-work. It blends. But I do feel like it should be, and should is a word I try not to use a lot, but it should be okay for us to acknowledge doctors have lives outside of work, and
Mhm.
that's still very good. That's probably even better for their patients to have a more well-rounded human being. And I was very curious in terms of having, and I know you have 7 children now. I feel like like that's definitely a lot of things outside of work. Um, how do you think about at the same time giving so much energy to patients in your work, which is very important, but also saving that energy for your loved ones, your kids, your spouse, just your family? Like, can't always be 100% on, but also feel like our world, there's a lot of pressure to feel like you have to be 100% on. Wonder how you navigate that. And I know that's a very big question, very open-ended question.
Yeah, so, I will freely admit that dealing with work-life balance, I mean, I don't think anybody ever masters it, and I struggle with it, to this day. It's a challenge, and so I think it's okay to acknowledge that, I don't think you're ever gonna get to the point where you're perfectly balanced all the time, it's kind of like you wanna be in the, middle between work and family and always be completely even, but that's just not life, right? You're gonna kinda be veering back and forth, and you try to stay in the middle as much as you can. Um, but I mean, there's definitely times, like, after I've come off an inpatient week where I just really feel like I'm so mentally in the headspace of work. It's really hard to not be distracted when I'm talking with my, husband or my kids, and that doesn't feel great. But, just happen to give myself grace that I will come out of it. I'll kinda go back to a little bit more of a better balance. Um I do think that one of the things that is very, you know, unusual in my circumstances, just that I've had young kids for like 21 years. My oldest is 21, and we've kind of always had young kids. And, I do feel like it's been a little bit easier for me just because, young kids are just so engaging and they're so funny and they're just so interesting to be around. And so it's very easy when I come home to just sort of get out of that work mindset, most of the time. I do wonder what it would be like if I only had teenagers or, kind of didn't have anybody at home. I think it would be a lot easier to be in that, kind of always be in that work mode. But again, like I said, I will freely acknowledge there are times where just stuff piles up at work or you have a project or you just get off, inpatient wards or something where it's just it doesn't feel good. You feel pretty imbalanced in your life. And I think too, I have definitely been trying to learn. This is very much a work in progress about, making sure I take time for myself for things that are important to me. I do try to exercise, pretty much every day as much as I can. It just helps me feel better. It's time to myself where I can listen to a podcast or music or something like that. And I've also been working on trying to foster some hobbies because it's really hitting me hard that I'm closer to retirement than I was at the beginning of my career, and my kids are growing up, and you know, I I can't just have work, I need to have other things in my life too. And so um I think really realizing that your life exists on a spectrum, and it's really kind of misguided to devote all of your energies to just work, because at some point you're going to want to retire, and life's going to go on, and it could be a really wonderful and fulfilling part of your life, if you've fostered other interests and relationships.
Yeah, yeah, I've heard the thought process of kind of looking at life like seasons. And so that's been helpful for me to just realize probably earlier on it's harder because we're just younger, building a foundation, and that's when you're just planting your seeds. But
Yeah.
as you're putting in that time, then wanting to be mindful of, well, what's going to happen once you've hopefully put in the very hard proper work at the right seasons, and now it's gonna all come to harvest, and you've put in the harvest and taken everything and contributed back to your community. And so I find that to be a really helpful analogy of thinking big picture, because you're right, it can get a little bit like check boxy. Just
Hmm.
wake up, get the routine's done.
Hmm.
Okay. But yeah, to step back and go, "Mm, well, all of that was toward there's some sort of a directionality. Uh, and I think of that as something I really wish I understood earlier, because I felt like I was the only person where it was hard. And it's helpful to know, well, it's kind of supposed to be hard, and it's hard for everybody.
Yeah.
And there may be a lot of this loneliness pandemic,
Hmm.
um, partially from the way we communicate, the social media we have, but I think also losing a little bit of the very practical minded generation who saw things as sort of just like seasons.
Hmm.
I even think about my grandparents, or just like older generations where they weren't even necessarily raised in a culture of thinking about themselves. It was more, it, it's going to be hard to achieve anything in this lifetime, but it's going to be for like the kids' next lifetime.
Hmm.
And just going like, oh wow, there's whole generations who lived in such a different mindset,
Yeah.
in different cultures too. So it
Hmm.
just really makes me curious, because I feel like this is something that probably you meditate on quite a bit, is thinking about the world your kids are going into
Hmm.
and how to help guide them. And by proxy of guiding your children, how would you guide the newer generation of trainees going into medicine with all of the challenges we have before us, things like shortages and of medical professionals, things like advancing technologies. We're learning new things every single day, have to keep up that fast pace. A lot more of the trust erosion, the social anxieties. Just how are you feeling like, and I know as a mom, I feel this too. Like, how do we help younger generations, ourselves too? Because I
Yeah.
count ourselves both as still very young.
I'm
But
not young, but I'm young in heart, but yeah. Yeah, it's a good question. I mean, I have actually thought a lot about this recently, mainly because I'm using AI all the time to a point that maybe I should be using it less, I don't know, but I mean, it's really been like very transformative in terms of like helping hone in on information, I feel like it's in many ways helped with better patient care. I've been able to, get educational materials or like synopses for patients or like, draft letters for, supporting a insurance denial or something like that. Like it's actually been extremely helpful. But um I've just thought a lot about this for my, kids, and I do not even understand the kind of world that they are entering into. And um kind of how transformative just social media and AI and, all of this technology is for the world that they're inheriting. Um, I think the thing that I have, tried to impress upon my kids is, number one, they are their own person, they are not me. And I think the same thing with when you have, trainees is, certainly try to pass along things that may be helpful, but certainly not making it sound like I know how things work because I certainly don't. Um, but I think also just being like very open and curious about learning myself. And I hope this is something that continues even after I leave medicine. I hope that it's never said of me that I say, "Oh, kids these days," or, back in my day, because the reality is kids are like amazingly smart and talented and just know things that, were beyond anything I could have comprehended at their age. And so, um, really just trying to be curious about the issues they're facing, to be supportive. I do think that one of the things I even see with, generations that are in medicine now is that it is so hard to get away from work. I mean, like previously when stuff was on paper or like limited EMRs, you could be off. If you weren't on call, then you were sort of not really reachable. And now it's you can be reachable all the time. And there's goods about that, there's also difficulties, and I think that's probably true in a lot of other careers. So, I do kinda worry about that for, the future of medicine is, burnout with kind of all this constant availability. Um, yeah, and for my kids, whatever career they're in, I mean, I want them to have that healthy balance and not just exist only online, but have quality relationships in their life as well. I would say like that is a huge blessing for having 7 kids. There's no shortage of people around. So, you know, um, during the pandemic, like I was never lonely. We had people in our house all the time. And like I'm not complaining about that. That was like a huge blessing.
Yeah. Yeah, I was even thinking and back to the part that we talked about where you're just honest with your patients and sometimes it would be kind of that nation the ding up. And I was even thinking about the way that we communicate in a world where we're constantly unreachable, even being able to healthily this and say, "Yep, I'm a caring doctor, and I'm gonna be able to do a better job caring for you in these kind of contexts."
Mhm.
And as opposed to the, "Yes, I'm always going to do everything you want and make you never afraid and never have a bad feeling, and everything's gonna be like, I'm gonna somehow control everything for you."
Mhm.
I I think there is a way to do that that isn't so making people feel like, "Oh, now we're not approachable, or now we're cold, or now we don't wanna work, or now we don't care about being a doctor." And a lot of it, I think, is that skill of communication. How do we come across to someone in a way that's just very honest, but very also very kind? I've had really great patients who I'm always really shocked, and maybe I shouldn't be shocked when they'll call me and they'll immediately apologize and be like, "I'm so sorry. I know I shouldn't be calling you. I don't know what to do."
Yeah.
I really appreciate when patients go. are looking at our relationship like that way. Uh,
Mhm.
they're starting to think about my well-being, like they care about my well-being too.
Yeah.
And it makes me want to even show up harder for them. That is a very funny feeling. Uh,
Yeah.
and so I think hopefully we can teach that younger generation through communication, how masterful communications can allow them to create space to meet their needs and
Yeah.
be able to meet other people's needs better that way. Yeah.
Yeah, I do think for, medical education now, unfortunately, just given all that students need to learn, I just don't know how many opportunities they have to really see like longitudinal patient relationships. Um, I'm not sure I really saw that. I mean, I think that I kind of had a sense of that from my own experience with our family doctor, growing up, but I don't think as part of my training, I really, really saw that. I feel like there was a lot of emphasis in like the cool procedures or the weird case, sort of getting in there for that one time, interesting situation. And, I think that, you just don't have the opportunities to really see what it's like to, care for a patient and really get to know them and their families over, a decade or more.
Yeah, and that's something I see too with the turnover in medicine, where sometimes it it, it seems like maybe, and this is me just going out on a limb, but sometimes maybe sticking it out in a tough situation, you can find that fulfillment that we look
Mhm.
for when we keep switching jobs, and sometimes you really have to. And I've certainly jumped around a lot in my training. I was moving like every 3 years, but I found a lot of like what you're saying of never having that long-term relationship until I got into the community and have been at my current job for 6 years. And you're right, I learned a lot about myself too. I have patients I've cared for the whole time, and I look back and I go like, "Oh wow, they were really nice to stay with me," because I think I was really not very mature back then, and they probably watched me this whole time, and so, yeah, it's very hard to train the next generation because they just know rotations and
Mm.
snippets and showing up perfect and,
Mhm.
checking off boxes, getting good grades. Oh, but
Yeah.
so powerful to have a mentor like you, Julie. Yeah.
Yeah, I mean, I feel like, when you go through medical school, there's such a performative aspect to it, right? Like, you're showing up fresh every month, to try to make a good impression and like, look, better than like, let's face it, trying to look better than your, fellow students, especially if it's something you're interested in, and like I just don't think that that's what medicine is. And so, valuing a little bit more that having patient relationships can happen and it can be a really gratifying part of part of your career. It doesn't just have to be, always looking like you're doing the right thing or everything. Um it's very hard. I think everybody who comes into medicine, they're high achievers and they're used to being successful, that it really feels like you're kind of, sort of turning soft and, not, you're not serious about your career if you really are thinking about how do I communicate better? Like, how do I show patients and staff and, other people who are in my line of work that I care about them and I'm interested in making medicine better.
Yeah, well, I feel like this conversation has been amazing, Julie. And we could go on forever because uh I just feel like I could always spend so much time with you. But I really appreciate this time we've had. I want to thank everybody watching Value Based Care, and I'm really excited to keep having more episodes. So hopefully everyone will come back and we'll have more of these kind of conversations. So thank
Well,
you
thank
again,
you so
Julie.
much for the invitation. It's lovely as always to talk with you, Kim. You're doing so many good things.